Hello everyone. Today let's clear up a big misconception about obsessive-compulsive disorder, or OCD. OCD isn't just about being neat or organized. It's a relentless cycle of intrusive thoughts and compulsive behaviors. Obsessions are unwanted, distressing thoughts that trigger intense anxiety. To cope, people feel compelled to perform rituals, like repeated hand-washing or checking, that offer only brief relief. But the relief fades, and the obsession returns, often stronger, trapping people in an exhausting loop. Imagine feeling you must tap a doorway 3 times or something terrible will happen, even if you know it's irrational. This cycle can consume hours each day, making daily life and relationships incredibly difficult. OCD isn't a personality quirk or a choice. It's a serious, often debilitating medical condition. Many people with OCD feel isolated and misunderstood, hiding their struggles out of shame. Understanding OCD means recognizing the real suffering behind the stereotypes. Compassion and effective treatment are key to helping people break free from OCD's grip. So, what's happening in the brain with OCD? Science shows it's not about willpower. There are real differences in brain activity. A specific brain circuit, the corticostriatal thalamic loop, gets stuck in overdrive, making the brain's alarm system blare non-stop. This creates a feedback loop, trapping people in obsessive thoughts and compulsive urges. Genetics play a big role. OCD often runs in families, with up to half the risk coming from your genes. But genes aren't destiny. They just make some brains more sensitive to anxiety. At the core of OCD is anxiety, a natural fear response that gets triggered at the wrong times. Obsessions spark intense dread, and compulsions are desperate attempts to neutralize it. The brain is trying to solve a problem, but it's stuck using faulty strategies. Understanding OCD as a biological process, not a personal failing, is the first step toward recovery. Every scientific discovery brings us closer to better treatments. The more we learn, the more hope we have for those affected. Knowledge is power, and it's changing lives. The gold standard for OCD treatment is exposure and response prevention, or XRP, a specialized form of cognitive behavioral therapy. The idea is simple. Face your fears little by little without performing the compulsive ritual. With a therapist's guidance, you gradually confront the thoughts or situations that trigger your anxiety. For example, someone afraid of germs might touch a doorknob and resist the urge to wash their hands. The key is to start small and build confidence step by step. The hardest part is resisting the compulsion, but that's where real change happens. When you don't give in, anxiety spikes, but then it fades on its own. Over time, your brain learns that the feared outcome doesn't happen, even without the ritual. This process, called habituation, weakens the link between obsession and compulsion. EXRP takes courage and support, but it empowers people to reclaim their lives. It's about proving to yourself that you're stronger than your anxiety. With practice, freedom from OCD is possible. Therapy is crucial for OCD, but sometimes medication is needed to make therapy possible. The most common medications are SSRIs, which boost serotonin and help calm the brain's overactive alarm system. Medication isn't a quick fix. It can take weeks to work, and finding the right dose takes patience. Side effects are possible, but a good psychiatrist can help manage them. For many, combining medication with therapy is the most effective approach. Medication lowers anxiety, making it easier to engage in XRP. Therapy then provides lasting skills to manage OCD and prevent relapse. Together, they form a powerful team for recovery. The future of OCD treatment is brighter than ever, thanks to new breakthroughs. Deep brain stimulation, or DBS, uses a device to send electrical impulses to overactive brain circuits, helping those with severe treatment-resistant OCD. Scientists can now monitor brainwave patterns to fine-tune DBS, making it more precise. Transcranial magnetic stimulation, or TMS, is a non-invasive option that uses magnetic fields to disrupt stuck brain patterns. New medications like D-cycloserine may speed up therapy by helping the brain unlearn fear responses faster. These innovations offer hope for people who haven't found relief with traditional treatments. Personalized solutions are on the horizon. Science is lighting the way forward. Let's clear up a common confusion. OCD and Obsessive-Compulsive Personality Disorder, or OCPD, are not the same. OCD involves unwanted, distressing thoughts and rituals people feel forced to do for relief. These thoughts are ego-dystonic. They don't align with the person's values and cause anxiety. OCPD, on the other hand, is about perfectionism and orderliness that feels right to the person, ego-syntonic. People with OCPD see their behaviors as positive, not problematic. OCD is about escaping fear. OCPD is about seeking control. Understanding the difference helps us use the term OCD correctly. It's about compassion, not stereotypes. If any of this sounds familiar, know that you're not alone. Millions share this struggle, and there's a dedicated community working to make things better. The hardest step is reaching out for help, but it's also the most important. OCD is treatable. Therapy and medication can help you reclaim your life. Recovery is a process, with ups and downs, but every small victory matters. The goal isn't to eliminate anxiety, but to learn you can handle it without rituals. Be patient and kind to yourself as you learn new skills. With today's treatments and tomorrow's breakthroughs, a life of possibility is within reach. You don't have to live under OCD's shadow forever. Seeking help is a sign of strength. You can do this.